If your baby has this condition and is not picked up, it may never walk properly and do well in sport in later years. So if you know about it and make sure that you look out for it and it is checked for at every baby visit with your doctor, it could be easily treated once discovered. Lean in, mamas. Let me share this very important data with you. I'm Dr. Chris, MD, helping mums to be happy and raise healthy, happy babies. Now, as a family physician, I've delivered more than 1,000 babies like yours, and I've coached tens of thousands of mums just like you with their newborns. So what is developmental dysplasia of the hip? In developmental dysplasia of the hip, they're also called the DDH, the socket or the hole of the hip does not develop and it doesn't form well. So the ball part of the joint may be completely or partly out of the socket. So sometimes the ball part may slip in and out of the socket. Often the socket is too shallow, so it doesn't stay in there, the ball. If this is not fixed, the hip joint will not grow well and it won't develop or form properly. Now this can lead to pain with walking or wobbling gait or limping or like hip arthritis, pain in the hip at a young age. Let me give you my understanding of the hip problem. You see, in evolution, we stem from the apes who walk on all fours, and so we're the first primates to constantly walk on our hind legs upright. This puts a lot of stress on the hip joint, which wasn't designed for this extreme upright range of motion. It places the human hips on the front edge and at the edge of this location all the time. So slowly this hip has to develop into a nice ball and socket. You see, little monkeys always cling to their mothers for the ride along, which always puts their hips in the open leg position. In the black African races, they carry their babies on their back in a blanket. They sort of wear their babies, they're strapped around their waist, and again in a wide open hip position. Now, CHD never occurs in these cases, but in our modern ways, we manage and position our babies with the legs together, and eventually they walk upright on two legs. All this puts the hip joint extremely out of the natural range, mixed together with our serious lack of minerals and trace elements. In today's world, we have a depleted agricultural soil. We are lacking those essential building blocks necessary for bone development, like selenium, boron, activated vitamin D, etc., calcium, magnesium, those things. No wonder congenital dysplasia of the hip is rapidly on the increase and on the rise. Now the latest trend is tight swaddling of the baby in the first 3 months in a Muslim wrap with their little legs side by side, completely not what is necessary for development of the hip socket. No wonder we see more and more of this kind of lurking disasters. So who gets developmental dysplasia of the hip? Any baby can have DDH, but there's a higher chance of being born with it in babies who are girls, are firstborn, or were breech babies in the womb with the buttocks down and the legs squished together instead of on the other way, opening up the hips and the head down position, especially during the third trimester of pregnancy or the last 3 months when space is tight and baby is big. Okay. Or we have a family member with a condition such as a parent or a sibling. Now, rarely a baby isn't born with DDH, but develops it after birth. Now, to prevent dysplasia of the hip in babies who aren't born with it, don't swaddle the newborn's hips and legs so tightly together. Always make sure baby's legs have plenty of wiggle room. Now, what are the signs and symptoms of developmental dysplasia of the hip? Let's have a look. So, developmental dysplasia of the hip doesn't cause pain in babies because they are not walking yet, so it can be hard to notice. Now, doctors check the hips of the newborns and the babies during child examinations and they look for signs of DDH. Parents could notice, for instance, that the baby's hip makes a popping or clicking sound that is heard or felt, especially when abducting or opening their little hips or legs, like when they're doing a diaper change. Or they can notice the baby's legs are not the same length, or one of the hip or the leg doesn't move or rotate the same as the other side. Or they notice the skin folds under the buttocks or the butts or on the inside of the thighs don't line or match up. The one side has more or looks very much different. So the child is reluctant also maybe to crawl or has a limp when starting to walk. Okay? What is hip laxity? Now, this is not DDH. Many babies are born with hips that feel loose when moved around. This is called neonatal hip laxity. It happens because the bands of tissue that strap the hip and the ball and socket together, called the acetabular ligaments, is extra stretchy. So neonatal hip laxity usually gets better on its own by 4 to 6 weeks of age, and it's not considered true DDH, but now the baby starts moving, so things tightening up or start kicking the legs. A baby whose hip ligaments are still loose after 6 weeks might need some treatment, so follow up for your doctor visits for the baby and check for hip laxity. That's important. Babies with any of these signs should see a doctor to have their hips checked. Finding and treating DDH early usually means there's a better chance for a baby's hips to develop normally. Now, without early treatment, DDH may lead to problems moving around, for example, a limp, or have pain in the hip, or get osteoarthritis, so breakdown and stiffening of the hip, and even in the back pains. With early diagnosis and treatment, children are less likely to need surgery and more likely to develop normally. Please subscribe and click like if you're getting value from this video. Then with the algorithm, YouTube shows it to more people that can also benefit. It's very important. How is developmental dysplasia of the hip diagnosed? Now, your baby's hips will be checked as part of the newborn physical screening examination within 72 hours of being born. Now, the examination involves gently moving the baby's hip joints to check if there's any problems. It should not cause them any discomfort, okay? Your baby should have an ultrasound scan of the hips between 4 and 6 weeks old if a doctor or a midwife or a nurse thinks their hips feel unstable, okay? Doctors find most cases of degenerative dysplasia of the hip during well-child examinations. That's the 2 weeks, 1 month, 2 months, 4 months, 6 months, 9 months, 1 year, 18 months examination that you routine go to the doctor for. If a baby has signs of DDH or has a higher risk for it, the doctor will order tests. Now, there's 2 tests that help the doctor check for DDH. One is an ultrasound, which is used, it makes use of sound waves to make particular pictures of the baby's hip joint. This works best with babies under 6 months of age, and that is because most of the baby's hip joints is still soft cartilage, and the bones too, which won't show up on an x-ray. And an x-ray is important and handy. It works best in babies older than 4 to 6 months because at that age, their bones have calcified enough to see them on an x-ray. Okay, how is developmental dysplasia of the hip treated? So a pediatric orthopedic surgeon is a specialist in children's bone conditions. They take care of babies and kids with DDH. Now, the goal of care is to get the ball of the hip in the socket and keep it there so that the joint, for a couple of months, so that the joint can grow normally. So the orthopedic surgeon chooses the treatment based on the child's age. Now, this option can include bracing, so they put these braces around the hip and around the hips or the middle and down the legs, so you can still change a diaper. And they can also do a closed reduction and casting, so they pop it in, they cast it, or an open reduction, which means they cut open surgery, put the ball in the socket, and then cast it. So a brace or a cast will hold the repositioned hip in place with open legs and will be on both sides. Even if the one hip is affected only, it will make sure that both sides develop normally. Sometimes the orthopedic surgeon also does a surgery on the pelvic bone to deepen a very shallow hip socket, and especially for a child older than 18 months. Okay, what else should I know? Kids will have regular checkups with their orthopedic specialist if they have this condition until they're 16 to 18 years old and done growing. Now, these help make sure the hip develops well and normally. Overall success rate is 90%. How are you enjoying your baby? Do you have any challenges? Comment below. I'll make the videos for you. Just tell me what you'd like to know about. This is Dr. Chris signing off. Ciao, mamas. Thank you for watching.